In the fight against COVID-19, the one and only medical factory in Libya, based in the city of Misrata, is now dedicated to producing protective gear. That includes medical gowns, face masks, shoe covers and other similar products. Staff who are striving to meet the government's needs say they have increased production of face masks from 7,000 per day to 40,000.
We are currently providing for general hospitals and a few private clinics, as they are the ones who will be dealing with corona on the front lines. We have doubled our staff and have increased production. We have a serious problem with bringing in the raw materials, but we are doing everything we can.
In the capital Tripoli, medical workers denounced a shortage of medical and personal protective equipment. As the virus sweeps the globe, several new cases have been registered in Libya. The health system here is already weak, and with the country at war, there is concern hospitals won't be able to cope with the added pressure coronavirus could bring.
I urge both parties and all others directly and indirectly involved in this conflict to immediately halt hostilities, to allow authorities to effectively address the COVID-19 threat, ensure unhindered access to humanitarian aid, and realize the ceasefire they have been discussing under the auspices of the United Nations.
With nearly 1.7 million people already in need of health assistance in Libya and high numbers of migrants and internally displaced people, organizations like the International Rescue Committee are warning that an outbreak of COVID-19 could have a devastating impact.
The year-long military campaign on Tripoli by forces loyal to the warlord Khalifa Haftar goes on. According to the United Nations, more than 280 civilians and about 2,000 fighters have been killed. The war has displaced about 150,000 people. While the war continues to claim lives, the staff at this medical factory are working round the clock to make more protective equipment for doctors and nurses. They're putting in extra hours for no additional pay. They say they don't want more money, they just want to help save lives. Mahmoud Abdelwahed, Al Jazeera, Tripoli.